Good evening all, this is the Sherwood Forest Hospital's February public broadcast and question and answer session, introducing Chief Executive Richard Mitchell to give us an update.
Thanks Robin. Hi everyone, lovely to see you virtually. Thank you for joining us for this February update. As Robin was describing, I'm the Chief Exec here at Sherwood. I'm also joined by Simon. Do you want to introduce yourself?
Yeah, hi, I'm Simon Barton. I'm the Chief Operating Officer.
And Robin is our Head of Comms and Engagement, guiding us through this. So this is, what is it, probably the fourth or fifth monthly update. I think we've given key opportunities to try and communicate directly to the community about what's going on at Kingsmill Hospital, Newark Hospital, Mansfield Community Hospital. Lots to touch on. We're going to give a bit of an update about where we are in terms of COVID patients. We'll update around where we are in terms of vaccination and visiting. Some of the conversations we're having about reinstating our services, looking towards the future. There'll also probably be a couple of other execs, colleagues joining us. So Simon in a moment is probably going to tell a little bit about some of the pressure on the organisation is dropping, but it certainly, from many respects, still feels incredibly busy. And before I hand over to Simon, I just want to thank, as I always do, first of all, the people who work in the organisation. So NHS workers, local authority workers, our volunteers, other public sector, huge support from the private sector over the last year. We're incredibly grateful for how much effort people have individually put into the provision of safe care over the last 12 months, but also we would continue to like to thank the community. So to thank you for everything that you're doing, whether it's your direct support for the hospital in the many different ways that we're getting the support at the moment, or whether it's the continued adherence to sort of the social restrictions that we live by. We are beginning to see, as you will know, a reduction in the COVID rate in our community, and that's for a whole range of reasons. And long may that continue, because that means that the plan that the Prime Minister laid out to us all on Monday evening, hopefully we'll be able to see a better finish to this year. So I'll hand over to Simon, and we've also got Julie Hogg, our Chief Nurse, that has joined us. Over to you, Simon.
Thanks, Richard. So we've currently got 108 COVID positive inpatients across the trust at the moment. That's down from a high of around 200, which was earlier in January, but still acknowledging that that's a much higher level than we saw last spring. So still the hospitals are still under quite a bit of pressure around that, particularly our critical care unit. So normally our critical care unit's maximum number of beds will be 9, but there remain 17 patients in our critical care unit, all of whom are COVID positive. And I think I've described before that the way we manage that extra the extra patients is by using our operating theatres as an extension of our critical care unit. And so by doing that, obviously we can't do as much elective operating as we would like to. So the priority goes to those patients in critical care, and that has reduced our elective operating. We're still operating on patients who are clinically urgent, and every patient on our operative waiting list has got a priority score assigned to them, which is assigned by the clinician who's responsible and looking after them, and all of the patients who are most urgent on there, the priority 1s and 2s, are getting treatment through the theatres that are available at the moment. That's at Kingsmill. At Newark, Newark is operating as normal as it can be in terms of the theatres there, and colleagues over at Newark are doing a fantastic job to keep a lot of the day case and short stay operations going for patients over there. So we've got critical care surged into theatres, which is affecting some of our ability to do elective care. In outpatients, so we continue to deliver outpatients, probably about 80% of the activity that we did pre-pandemic. That's largely due to social distancing within the clinic areas and having to maintain that within there. and obviously there'll probably be patients on this call. There's a more wide-ranging offer of an outpatient appointment now, so our clinicians are doing them by telephone or virtually through devices such as this. So that's really positive, and we continue to sort of offer quite a high level of outpatient care to patients. And then our cancer services are broadly operating as normal. So patients who are on the suspected cancer pathway are getting through those pathways relatively quickly. All our scanning and stuff is almost back to normal operating levels. And obviously patients who need surgical cancer treatment will get that in the theatres that are available. So I think the hospital overall remains under pressure from emergency care. It remains under pressure from the incidence of COVID, but we are offering the vast majority of our services as normal, with a decrease in the Kingsmill operating levels due to the surge of critical care. That's a brief summary, Richard. I don't know if there's anything you would like to ask me about that.
Very clear. Thank you, Simon. There may well be some questions coming through about that, but welcome, Julie.
Hello.
Hi, we've got Julie, our chief nurse here. I've given a very brief overview. Simon's just updated on the situational report. Anything that you would like to update on visiting or anything else?
Yep, thank you. Apologies that I was a little bit late. So visiting at the moment, the restrictions remain in place. So we are operating a compassionate visiting policy. And that means that unless a patient is end of life or requires a carer, there is no visiting currently. If you're attending an outpatient appointment, we ask you to come on your own unless the patient requires a carer or is expecting to receive news that they need somebody to be with them for the appointment. The maternity policy remains slightly different because birth partners are considered birth partners and not visitors, so we are doing our absolute best to accommodate birth partners across that pregnancy journey. But I'd encourage people to check with their midwife about restrictions that may be in place. We don't have any plans to review the visiting policy until the restrictions nationally begin to loosen, and I think that is sometime in March, so we'll take the next couple of weeks to think about what that means for visiting patients in the hospital. We'll need to think about how much COVID we have in the hospital as well to keep everybody safe.
Thanks, Julie. Probably the other key thing I'll update on before handing over to you, Robin, to guide us through any questions is obviously vaccination. We updated in quite a bit of detail at January's public Q&A about the vaccination programme. You may remember, so we started vaccination at Kingsmill Hospital on the 8th of December. From memory, on the first day, the 8th, we vaccinated, I think it was about 32 people. We're now up to about 600 people being vaccinated a day at Kingsmill Hospital, which is a wonderful achievement. Obviously, Kingsmill Hospital is a hospital hub. It's part of the wider Nottinghamshire vaccination programme, working in partnership with Nottingham University Hospitals, Notts Healthcare, primary care, local authority, CCG, etc. So it's a team effort, but 40,000 people going through Kingsmill is fantastic. They have been in line with the Joint Committee for Vaccination and Immunisation. Also, obviously, healthcare workers and care workers. We've started vaccinating recently clinically extremely vulnerable young adults with learning disabilities and their carers. And I was down in the vaccine centre on Friday afternoon listening to some of them, and it's incredible to hear the stories about how this vaccine programme is providing hope and optimism. As I said at the beginning of this, that hopefully we're moving into an easier time of year. We're just about, haven't quite started it, but we're just about to begin now the process of second doses. So if you're one of the 40,000 people who had your first dose at Kingsmill, we would have contacted you or will be contacting you about your second dose, and your second dose will be 12 weeks from when you had your first dose. a couple of points to conclude. I think the vaccine programme is going remarkably well. Thank you to everyone who's been engaged with it. It's really important, though, that we have the collective effort to ensure that we continue to follow that JCVI guidance that I've referenced. We're not in a position to bring people forwards for their vaccine if they're out with that guidance. Please, as the vast majority of people are doing, please take your turn. And as I also said, this is a network approach. So whilst you may be wanting to have your vaccine at Kingsmill, there are many other opportunities across Mid Nottinghamshire to have your vaccine. And as we're hearing in the national media, I think it's a real success at the moment. The number, I think, what was it, 18 million at the beginning of the week going through. That's just simply remarkable when you rewind and think on the 7th of December, it was a proof of concept. So a huge effort, and that, along with a whole range of other things, as long as we adhere to it, I do believe mean that the coming months will be hopefully better and easier than the period that we've been through. So I'll pause there. Anything you want to guide us through, Robin?
Thank you, Richard. Yeah, we've got some questions starting to come through, so I'll remind those watching, if you want to ask any questions, there is the chat function there. So this is your opportunity to ask anything you'd like to from our senior colleagues at the Trust. We do have a couple of questions coming through, a couple around vaccination, which I'll start with. So Mel has asked in the chat, will Kingsmill be mixing vaccine manufacturers for the second jabs? Julie, is that one that you'd be able to answer?
I'm happy to answer it.
Or Richard?
No. If you had your Kingsmill been providing the Pfizer vaccine, you'll have the Pfizer vaccine for your second dose.
Great, thank you.
And I can expand on that. And for people who've had the vaccine at the Newark Showground, or I can't remember what we're calling it, used to be the Wicks in Mansfield. Whatever the vaccine you had there, you'll have that as your second dose.
Great.
And it's just a reminder. It's really important that that we do remember the date of our second dose, and that we come forward and have it. And for people who are either in the JCVI category and haven't had your first dose yet, personal choice, but it's a really wise choice to have it. Great way of protecting yourself and your family, etc. And then if you're in the categories that we're beginning to come towards, please take the opportunity to have your vaccine.
Thank you, Richard. There was another question that I'm going to summarise that came through in advance, came through from Jane, again around the vaccine, but trying to understand a bit more about some of the way the appointments are working. So Jane referenced that we're doing really well locally, but had seen a number of spare appointments both at Kingsmill and at other vaccination sites, and is questioning whether we've got the opportunity to expand that into further groups, so into sort of cohort 7 and 8, to try and fill those vaccinations. She believes we're not utilising the centres to their full capacity. Again, Richard, is that one that you'll be able to cover?
Yeah, I'm happy to answer it, and then Julie may wish to add to it. I can't comment on whether we are utilising the full capacity. I think it's inevitable that when you've got a programme as complex as this, that there may well be the occasional spare slot. But I want to assure people, as we've said previously, we're not wasting the vaccine. We haven't been wasting the vaccine at any point during the first 3 months of the programme, and that will continue. At the moment, changing the group of people that we're vaccinating, so moving into other cohorts, is not something that Kingsmill or Sherwood or even the Nottinghamshire system could unilaterally agree to do. It's part of that wider national programme, and from a public health perspective, it's really important that we move at the same speed. If there is, what we have seen because of the success of the programme, and thank you to Jane for referencing it, as we're getting to a very high uptake within one of the cohorts, we're then seeing a movement into the next cohort sooner than we expected. So if we do feel that the local position and the national position suggests that we are beginning to get to a situation where there's a risk that the vaccine would be wasted, I'm sure that would trigger a movement, but we're not at the position at the moment. And as I say, we're certainly not wasting the vaccine. Anything you want to add to that, Julie?
No, I don't think so. I don't think so.
Okay, just going back to the questions that are coming through in the group. I think we've answered the other question that was in the chat, which asked specifically around if we were planning to change visiting guidelines when lockdown restrictions change, and Julie covered that earlier. And that's all we've got at the moment, so we usually get many more questions than this. So perhaps I can ask a question, if that's okay. Obviously, we had the government announcement earlier this week with the roadmap to opening things up. I'm wondering whether colleagues feel sort of more positive as a result of that, and feel that there's a way forward and a way out of this.
Your view, Simon?
Yeah, I mean, this is my sort of personal view. I think it's a good approach. It does make me feel optimistic. It shows good belief in the vaccine, and a lot of the data that was supplied during that briefing and has come out since shows the efficacy of the vaccine is strong. And so I think it's very positive. I like the idea of releasing certain restrictions and then watching for a period of time and seeing what the evidence is on the back of that, and then releasing more and watching for a period of time. I think that's quite a good approach, and I think if we can make this work over the coming months, hopefully that means we won't have to see other lockdowns, which I don't think any of us want to see. But also whilst reducing the pressure on the hospitals, and us working on our plans to get the hospitals into a position where we can offer a lot more elective care to patients.
Thanks, Simon. Julie?
Yeah, I think I would echo that. I think it does give me a lot more hope that we will return to some level of normality this year. The days are getting longer, so it is lighter in the morning, and it's lighter when we leave work as well. So I think generally it feels much more optimistic. I guess, of course, we've all got our part to play in that, and we need to make sure that we are following the rules irrespective of vaccination.
Yeah, I agree with both of those points. Simon's point about understanding the logic, I think it is logical. I think the gaps are sufficiently wide so that the government and the scientists can test, is this a safe step before moving to the next step. And I agree with Julie's point about the individual responsibility here. Things are, from a rate of COVID in the community, so from a transmission rate, from a rate of COVID in the organisation, critical care, etc., things are moving in the right direction, but it's really fragile, and there's going to be a risk that as the vaccination programme continues to expand, we all sort of step back and think, wow, this is sorted, and let's go out and have mass gatherings, and we've seen in the past the impact that can have. So I'm a firm believer in I believe I'm a firm believer in trying not to criticise others and looking at the personal responsibility I can bring to this. So we touched, I think it was before Christmas, we had a brief, and we sort of said, how would you describe your Christmas? And we all independently said quiet. I'm sure independently we're still in our personal lives, having a quiet personal life. There's not a huge amount that we can do at the moment, but I think we all do feel hopeful and optimistic that the steps that are being taken will mean that the future will be better than the past. Anything you asked the question, Robin, any views from you?
So I do feel it has given me a bit of a boost, I think, this week. It's sort of it's made me start to make some plans for the summer and beyond, tentatively, accepting that we need the data to follow through to be able to deliver these things, but just that process of actually being able to make a plan and look forward to things is making a big difference to me. I'm just going back to the chat. There's a follow-up question on the vaccine. I don't know if it's from the same individual. I think we've covered most of it, but I'll repeat it again, Richard, in case it's worth sort of reiterating the message, if that's okay. So it's coming anonymously, and they say there are lots of spare appointments. Why can't these be filled with the next group of people, or people that are willing to come last minute? Surely the aim is to vaccinate as many people as possible. Anything extra you want to say on that, Richard?
I'll reiterate what I said, but it may well be, given my short-term memory loss, that I'm not reiterating and saying a different point. So the first point, or the concluding remark about the aim is to maximise as many people are vaccinated, absolutely, and that's why I think our process is working effectively. We touched on we've vaccinated 40,000 people in line with the JCVI guidance. Kingsmill isn't the biggest hospital in the country, but it was identified as one of the top 5 hospital hubs for vaccine provision over the first couple of months. So the team here are doing a fantastic job. I was just thinking through the first point was about sort of empty slots. I'm not sure we can categorically say that there are empty slots, but I will personally go and check that, because we're saying that there's a slot on the system that appears to be empty. It might not be that it is empty, but I need to check that. The fundamental point is, can we expand the cohorts that we're vaccinating? It's not something that Julie, Simon, myself, Robin and others, we can't unilaterally agree to it. It needs to be managed really, really carefully. I think we have moved on from talking about the change in dates for the second dose, but I'll open it up again. We moved from booking in the second dose, I think, from 4 weeks to 12 weeks. That was a national change that we couldn't influence or control. We had to adhere to it, and actually I think it was the right thing to do. The national decision is that we're only going to concentrate on the cohorts that we're vaccinating at the moment. When there is a body of evidence that we have run out of people to be appropriately vaccinated, I'm sure very quickly we'll then move to the next cohort or the cohort beneath that. So to conclude, I think the programme at Kingsmill is going really well, and fundamentally we are vaccinating safely huge numbers of appropriate people. The second point is, I'm not sure that there are slots going empty, but I will check that. We're certainly not wasting the vaccine. And the third point is, at the moment, we can't expand the priority cohorts. If for the person who's raised that, or anyone else, if my answer is incomplete or you would like to challenge it, and that's absolutely fine. And in our roles, I think we're absolutely clear that it's important that we hear from people and people shape our decisions, or if we're not communicating effectively, you tell us. My email is richard.mitchell, MITCHELL, the number 2 at nhs.net, and I'm more than happy for anyone to contact me directly. And each week, or we're now doing it fortnightly, we send out a brief communication to the community, and my email's at the bottom of that as well.
Thank you, Richard. I think if we've got no more questions, perhaps we'll just go around the group and have any sort of final comments or reflections before we close, if that's okay. Who wishes to start?
I'll go first this time. So I hope that's made sense to people. There's probably not a huge amount of new information in there, but I think there is a bit of as we've all heard from people, cautious optimism, a renewed sense of hope that things are beginning to move in the right direction, but it is pretty fragile. And that ties back to the bit about individual responsibility. We are incredibly grateful for the support that we're receiving from the community. If you've got views about how you can make this hospital a better place to work or to receive care, please let us know. As I've said, I personally think we are quite a humble organisation. I think we do focus on the areas that we need to improve on, as opposed to saying that life is perfect, because we know that life isn't perfect. And just on my final point would be, I referenced the letter that we sent out on Monday, I think it was this week. In the health world, there's a couple of really important things happening in the next 2 weeks. So on the 11th of March, the national information about staff engagement for the last 12 months is communicated. I think many of you will understand that Sherwood's an organisation where we firmly believe that if we look after the people who look after the people, that gets them to a good place. Fundamentally trying to improve the employment conditions, improve the working life for people who work at Sherwood. Doing that will provide safe care. I can't say too much because the information is embargoed and I haven't seen all of it, but I'm confident that on the 11th of March, Sherwood, your 3 local hospitals, is going to done exceptionally well compared to other organisations across the Midlands and the wider NHS in terms of its overall rating of culture as judged by the people who work here. And then on the 17th of March, there's sort of the industry awards from someone called the Health Service Journal, and the big prize is something called the Hospital Trust of the Year, or Trust of the Year. And for the 2nd year running, Sherwood is down to the final group for that. So we're hopeful that we will do well. Whether we do well or not, we'll continue on on our journey of trying to improve patient care and improve the life of people who work here. So I'll leave it there. Julie?
Yeah, not much to add to that, actually. I think just a thank you for the huge amount of support that we've had, just an acknowledgement that things are beginning to look a bit brighter, but as you say, it is fragile and it's important that we all continue to play our part in that. So thanks very much.
Thank you, Simon.
Yeah, I think just we did acknowledge it, but just recognising again a couple of things. Firstly, how hard all our colleagues who work for Sherwood and give care and support the giving of care are working at the moment, continue to do so, and they're doing an incredible job, and that's obviously widely reported in the media, but we're very, very grateful to them and everything they're doing, and the flexibility that they're working. And then to patients who are waiting for elective care, we're really grateful for your patience as well. It's not easy being on a waiting list and waiting a little bit longer than you would have done previously, and we hope over the coming months that the plans that we're going to be working on and putting in place will increase the number of elective patients that we can safely treat within the hospital, even with COVID being around a bit. So hopefully we'll have some better news for patients on our waiting list over the coming months as well. So thank you for your patience.
Thanks, Simon. I think that last point you said was really important. If we hadn't have emphasised that previously, thank you for emphasising that. We do know that patients are waiting longer than they would want or we would want at the moment, and we will do everything possible to reduce those waits over the coming months. Robin, over to you to conclude.
Thank you, Richard. I guess I think everyone's summed it up really well. I think it's been a really difficult time, particularly since Christmas. It's felt like a long stretch for everyone, but as a community, I think we've done fantastically, and that's reflecting in the way that the numbers are coming down at the moment out there. So it's that sort of message not to stop, not to give up, keep going, and that I think we're getting there. And obviously thanks to all our colleagues that are doing an incredible job. Thanks everyone for tuning in. We'll keep sharing these through our social media and other channels, and thank you for participating.
Cheers, Robin. Thanks. You.
Bye.
Thank you.
Thank you. Bye.